Today we're going to be talking about human papillomavirus, or HPV. So what is HPV exactly? HPV is the most common sexually transmitted infection in the world. It's a compilation of more than 150 viruses, and it's named for the warts or papillomas some types of HPV can cause. And now for some staggering statistics concerning HPV. According to the Centers for Disease Control and Prevention, 80% of people will get an HPV infection in their lifetime. HPV can be contracted through vaginal, anal, or oral sex. The virus spreads via skin-to-skin contact, and HPV can also be transmitted during childbirth, generally resulting in genital or respiratory infections for the infant. Some risk factors for developing HPV include having a high number of sexual partners, intercourse with someone who has had many sexual partners, direct contact with warts, especially genital, a weakened immune system, and contact with the surface where HPV exposure has occurred. Gardasil 9 is the HPV vaccination of choice in the United States, and it's the best means of protection against the virus. Vaccination is recommended prior to a child or adolescent sexual debut, and women can be vaccinated from ages 9 to 26 and men ages 9 to 21. So why is this so important? HPV can cause cancer. Women can develop cervical, vaginal, and vulvar cancer, while men can develop penile cancer. In addition to this, men and women alike can develop cancer of the mouth, throat, anus, and rectum. Most types of HPV are asymptomatic. The only obvious symptom is warts, especially genital warts. These can be small, flesh-colored or gray, and can be a single bump or clumped together like the head of a cauliflower. Sometimes warts can even be invisible to the naked eye. Cervical cancer screening is performed in women in order to detect abnormal cells. Cytology-based screening includes the Pap smear and HPV testing. Types HPV 16 and 18 are the most common high-risk or oncogenic genotypes of cervical cancer. Women ages 21 to 29 need to have a Pap smear every 3 years, while women ages 30 to 65 need to have a Pap smear and HPV co-testing every 5 years. HPV testing examines cervical cells for the presence of high-risk strains such as types 16 and 18. An abnormal Pap smear showing type 16 or 18 requires immediate follow-up. An abnormal Pap doesn't always mean cancer, but according to ACOG, additional testing is needed to determine if the cellular changes are cancerous. HPV testing has either a positive or negative result. Sorry, boys. Unfortunately, there is no HPV testing which can be performed on men. Diagnosis in men is purely done by reported symptoms or by performing a visual examination. There is no treatment for HPV, but getting vaccinated and modifying at-risk behaviors can help protect you. If cells taken during a Pap smear show severe irregularities, treatment is required. Treatment options include a LEEP procedure, cryotherapy, laser therapy, and conization. And that is the end of my video. I hope you learned some facts about HPV, and thanks for stopping by.